Now that you're on board the Corsair Express, let us begin our journey. We're now starting on week one of our course. And during this week, we'll be traveling back in time to the 1930s in China, when the first primary health care project to improve the health of impoverished peoples was established. Then we'll travel quickly through time, reviewing some historical milestones in the development of primary health care, and consider more recently some of the ongoing tensions that have persisted between comprehensive and more selective approaches to primary health care. Some people refer to these as the tension between vertical and horizontal approaches to providing healthcare services. We'll go back briefly to Harvard University in the 1950s and some of its influence on the development of primary health care, and then talk a little bit about one of the pioneering primary health care projects that was established in India, in North India, in the 1960s and early 1970s. And then we'll take a visit to Alma-Ata, Kazakhstan. In 1978, Alma-Ata was a part of the USSR, and that is, of course, where the International Conference on Primary Health Care was held in 1978, a seminal event for the purposes of our course. You will find the lecture that you'll be listening to this week and some of the subsequent lectures in later weeks to have some repetition, some references perhaps to other lectures that you won't be exposed to. But don't be alarmed by any of these inconsistencies. They're minor, and I don't think they'll detract from your overall learning for this course. Once you have listened to the lecture for this week, I want you to reflect for 5 minutes or so, and then to post any thoughts that you have on our discussion forum. If you have any comments or questions, if you disagree with something that has been said, or if you have your own experiences or opinions about the topics that have been discussed, we invite you to post them on the discussion forum. Your participation in the discussion forum will enrich your own learning as well as the learning of your fellow students. And this, of course, holds true for all the weeks that follow as well. We want you to be an active participant in the discussion forum. There are 3 discussion fora for posting. There's the student forum and the professors forum and the technical issues forum. If you're having any problems accessing the materials for the course, you can let us know by sharing this on the technical issues forum. If you would like to ask me for my opinion about an issue, if you want some clarification about something that I've presented in class in one of the lectures, or if you'd like some additional information, you can post your query on the professors forum. If you would like to share a comment with your fellow students, then we urge you to post this on the student forum. A teaching assistant and I will be checking the professors forum several times a week, and we will do our best over the course of several hours each week to respond to the most important queries that you post. We strongly encourage you to use the voting mechanism to give your opinion about the posts that have been made. This will help to guide me in responding to the postings that you consider to be the most important. Many of you have had important field experiences and have been working on issues that we will be addressing in this course. So I urge you not to hold back and to share them in the opinions that you have developed as a result of your experiences. We want you to share these with the class, and this will greatly enhance the learning experience for all of us, me included. So one of the great things about teaching is being able to learn from students. The required readings this week are the Declaration of Alma-Ata itself, only 3 pages long, but one of the seminal foundational pieces of modern global public health in my view. There are also 2 reflections on the Declaration of Alma-Ata that were published in the world's leading medical journal, The Lancet, in 2008, and a special issue commemorating the 30th anniversary of the Declaration of Alma-Ata. One of these is written by the editors of The Lancet, and the other by Dr. Margaret Chan, the Director General of the World Health Organization. Once you have finished the lecture and the required readings, move quickly to take the multiple choice quiz. As we mentioned earlier, you can take this quiz up to 4 times. Please remember that our goal for each week of the course is 1 hour of lectures, more or less, 1 hour on the readings or videos that I have assigned for you, and 2 hours of reflection, discussion forum participation, preparation for your weekly quiz, and preparation of the 2 short papers that you will be submitting, one in week 2 and the other one in week 4. I think that you will find that you can complete this week's work in a little less than 4 hours. However, during weeks 2 and 4, when you'll be writing your papers, you may need a little more than the 4 hours to complete your work for that week. So, have a great week 1 on the Coursera Express and enjoy this first leg of your journey.